This video is for educational purposes only and isn't meant to replace medical advice. Always talk to your doctor before making any health changes. What if I told you beating depression could start with your breakfast? Comment gut heals if you're ready to rethink mood support. Today, we're going to flip the script on traditional mental health advice and dive into 7 gut-centered strategies that can transform your mood from the inside out. Along the way, I'll share real stories, surprising research findings, and practical steps you can take today to reclaim your emotional health. Hello and welcome back to Alpha Health Lab, where we bring you science-backed strategies to optimize your wellness every single week. On this channel, we don't just gloss over headlines, we dig into the data, test unconventional approaches, and bring you real stories from people who have tried these strategies and lived to tell the tale. If you're new here, hit that subscribe button and ring the bell so you never miss an evidence-based health tip. Let's get into it. 1. The chemical imbalance myth and SSRIs limitations. Depression has long been blamed on a chemical imbalance in the brain, but decades of research haven't found a consistent deficit in serotonin levels among people with depression. In fact, large-scale analyses of spinal fluid measurements and PET scans often show normal or even elevated serotonin activity in those diagnosed with major depressive disorder. It suggests that simply boosting the amount of serotonin floating around in your brain might be akin to shoving more water into a bathtub that already has a leak. This theory was originally speculative and never formally proven, yet it became the foundation for billions in pharmaceutical profits. Harvard psychiatrist Dr. Joseph Glenn Mullen even stated that the theory was more of a marketing tool than a medical fact. Think about that. Millions of prescriptions based on a myth. What this tells us is not that people aren't suffering, but that our understanding of the root cause might be fundamentally flawed. SSRIs like Prozac, Zoloft, and Lexapro work by blocking the reuptake of serotonin, essentially forcing more of it to linger in the synaptic cleft. But clinical remission rates in the landmark STAR-D trial hovered around just 30% after the first SSRI, with many patients cycling through multiple medications without full relief. It's like turning up the radio volume hoping to hear the music more clearly, only to realize the speakers themselves are damaged. Patients frequently describe these drugs as emotional numbing agents that dull life's highs and lows alike, trading suffering for stagnation. Dr. Peter Gotze and other critics argue SSRIs perform no better than placebo in many cases, yet carry significant risks. Sexual dysfunction affects up to 70% of users, emotional blunting leaves people feeling flat, and withdrawal syndromes can mimic or worsen depression. And let's not forget the infamous tryptophan contamination incident in 1990, which briefly banned a major serotonin precursor and conveniently coincided with Prozac's growing market share. If a treatment can't fix root causes and often introduces new problems, it's time to rethink our strategy. Comment, "My myth busted," if you're ready to move beyond the chemical imbalance theory. 2. St. John's wort. A multifaceted, natural remedy. Unlike SSRIs, St. John's wort isn't a single-target pharmaceutical. Its hyperacin and hyperforin compounds modulate serotonin, dopamine, and norepinephrine simultaneously, while also exerting anti-inflammatory effects and reducing cortisol production. A 2016 Mediterranean infection rivals that of SSRIs with significantly fewer adverse events. These compounds don't just tweak a single switch, they fine-tune an entire network. Hyperforin also affects GABA and glutamate signaling, making it useful for both depression and anxiety. In fact, in many German and Austrian clinics, St. John's wort is the first line of treatment for mood disorders, not the alternative. Patients often report improvements in energy, emotional range, and even libido, areas typically dulled by SSRIs. Patients in European clinics often prefer St. John's wort due to its broader mechanism of action, addressing both neurotransmitter balance and systemic inflammation. Meanwhile, the medical establishment warns only of serotonin syndrome when combined with prescription antidepressants, yet real-world case reports of that are vanishingly rare. Most users simply enjoy improved mood, better sleep, and reduced anxiety without feeling numb or detached. When you compare a single target blockbuster drug with its narrow focus and high side effect profile to a botanical offering multi-pathway support, the choice seems obvious. Nature's complexity often surpasses our reductionist designs when tackling multifactorial conditions like depression. Comment, nature heals if you believe in the power of whole plant remedies. 3. Your gut, a neurotransmitter factory. It may surprise you, but roughly 90% of the body's serotonin is synthesized in the gut by enterochromatin cells, not neurons in the brain. That gut-derived serotonin primarily regulates intestinal motility, yet a significant portion influences brain circuits via the vagus nerve. Similarly, your gut microbes produce oxytocin precursors and other neuromodulators that shape mood, stress resilience, and social behavior. Even more fascinating, recent studies have identified that certain bacterial species, like Lactobacillus rhamnosus, can modulate GABA receptor expression in the brain via vagus nerve signaling. This means your mood, anxiety levels, and ability to feel pleasure are all affected by microbial interaction. Take oxytocin, often dubbed the love hormone. It's crucial for parent-child bonding and also enhances trust, empathy, and stress recovery in adults. When your gut microbiota is balanced, oxytocin production ramps up naturally, giving you a sense of calm connection without any prescription. Anecdotally, one viewer, Jane from Oregon, told me that after improving her gut health, she felt more engaged at work and excited to see friends again, like someone flipped a switch. If you've been chasing mood relief solely through brain receptors, you've overlooked the body's largest neurochemical factory, your digestive tract. Tuning into gut health means tapping into a far richer chemical toolbox than SSRIs ever could. Comment gut power if you're ready to harness your own neurotransmitter factory. 4. The gut-brain superhighway. The vagus nerve is the primary communication line between your gut and brain, carrying up to 80% of its traffic from the gut upward. This means your brain spends most of its energy deciphering signals from the digestive tract, nutrient levels, microbial metabolites, inflammation markers, while only issuing about 20% of commands downward. If your gut is inflamed or imbalanced, you'll experience anxiety, brain fog, and mood dips before your brain has a chance to compensate. One groundbreaking study showed that electrical stimulation of the vagus nerve significantly reduced symptoms of treatment-resistant depression, prompting the FDA to approve VNS, vagal nerve stimulation therapy. But you don't need surgery to improve vagal tone. Practices like chanting, gargling, yoga, and breathwork can activate the vagus nerve and improve mood regulation within days. Studies on heart rate variability, a measure of vagal tone, show higher HRV correlates with better emotional regulation and resilience to stress. Techniques like deep diaphragmatic breathing, cold exposure, and vagal nerve stimulation exercises can boost that tone. But nothing beats feeding the gut with the right microbes and nutrients to optimize signaling at the source. Treating mental health without addressing the gut-brain axis is like patching a hole in a dam while ignoring the structural cracks below. Strengthening that superhighway through diet, lifestyle, and targeted probiotics is essential for lasting change. Comment: vagus strong if you believe mental health starts below the belt. 5. Dysbiosis and gut inflammation drive low mood. When researchers sequence the gut microbiomes of people with depression, they consistently find reduced diversity, especially of butyrate-producing bacteria like Faecalibacterium and Rosaburia, and overgrowth of inflammatory strains such as Proteobacteria. This dysbiosis triggers cytokine release, IL-6, TNF-APA, that crosses the blood-brain barrier, activating microglia and perpetuating neuroinflammation linked to anhedonia and cognitive decline. One particularly revealing study from China found that fecal transplants from depressed humans induced depressive behavior in mice within days. That's how powerful microbial ecosystems can be. On the flip side, when people with major depressive disorder were put on a Mediterranean-style anti-inflammatory diet, Nearly a third saw remission after just 12 weeks. No drugs required. Chronic gut inflammation doesn't just cause bloating or discomfort. It sends a storm of inflammatory mediators through your bloodstream, contributing to fatigue, irritability, and brain fog. One clinical trial showed that participants with ulcerative colitis reported significant mood improvements when their gut inflammation was brought into remission, illustrating the gut-mood connection in action. Rebuilding microbial diversity and quelling inflammation demands more than a generic probiotic bottle. It requires prebiotic fibers, resistant starch, inulin, polyphenol-rich foods, berries, green tea, and fermented foods to reintroduce keystone species. Personalized protocols, sometimes guided by microbiome testing, offer the best chance to reset the ecosystem for improved mental health. Comment: Microbiome Reset, if you're committed to healing from the inside out. 6. Antibiotics, a double-edged sword for mood. Antibiotics can be life-saving, but they also act like gut clear-cutters, wiping out beneficial bacteria overnight along with pathogens. The 2017 cohort study found that patients treated with broad-spectrum antibiotics had a 30% higher risk of developing depression within 6 months compared to matched controls. Why? Because the microbes producing your serotonin, gamma-aminobutyric acid, and short-chain fatty acids get eradicated, leaving you scrambling for chemical balance. This risk is even higher for people who undergo multiple antibiotic courses in a short period. The more your microbiome is disrupted, the longer it can take to recover. In extreme cases, people develop post-antibiotic syndromes marked by mood swings, digestive issues, and unexplained fatigue, all linked to microbial collapse. Many people only connect their depression to antibiotics in hindsight. Ask when their low mood began, and they often point to a course of antibiotics weeks or months earlier. Studies show that without intentional reseeding, critical microbes may never fully recover, leading to persistent dysbiosis and mood disturbances. If we want to preserve mental health, antibiotic stewardship must include proactive gut support, targeted probiotics, synbiotic supplements, and a diet rich in fermentable fibers. This approach minimizes collateral damage while still addressing infection, putting your mental well-being on equal footing with your physical health. Comment: Protect the gut, if you'll think twice before that next antibiotic. 7. Eluteri, the probiotic game-changer and how to cultivate it. One superstar microbe rarely found in commercial supplements is Akkermansia muciniphila, often nicknamed Eluteri. It specializes in digesting the mucus lining of your gut, strengthening barrier integrity, modulating immune responses, and producing metabolites that signal to the brain. Clinical research links higher A muciniphila levels with reduced inflammation, improved insulin sensitivity, and even enhanced mood. This strain plays a gatekeeper role. When it thrives, your gut lining stays intact, inflammation remains low, and microbial communication with your brain is optimized. Low levels of A. muciniphila have been associated with obesity, depression, and metabolic syndrome. But with the right approach, you can restore it from scratch. No commercial supplement needed. Dr. William Davis pioneered a DIY approach. Ferment ultra-pasteurized half and half in a yogurt maker at 37 DGC for 36 hours. Then consume a half cup daily. This cultivates A. muciniphila in sufficient potency to colonize your gut. Anecdotally, I've heard from dozens of viewers. Our friend Marcus from Toronto reported, "My anxiety evaporated, and I actually look forward to social gatherings after consistent use." Since adopting this practice, many people notice profound shifts. Deeper, more restorative sleep, elevated baseline mood, increased social confidence, and even faster muscle recovery, thanks to microbe-driven stem cell activation in muscle tissue. It's like having a personalized mental health factory sitting in your fridge. Comment: Eluteri magic if you're ready to try this probiotic revolution. Your depression isn't a personal failing or merely a shortage of brain chemicals. It's a systemic signal that your gut ecosystem needs attention. By embracing gut-somic strategies, dispelling outdated chemical imbalance myths, harnessing whole plant remedies, repairing the gut-brain superhighway, restoring microbial diversity, practicing antibiotic stewardship, and cultivating superstar microbes. You can transform your mental health from the inside out. Thank you for joining me today. If you found this video valuable, please subscribe, ring the bell, and share which gut strategy you'll try first in the comments. Together, let's build a happier, healthier mind, one microbe at a time.